I wanted to pursue a career in neuropsychology to combine the opportunity to work with patients in a medical setting, but also go a little bit deeper from the psychology perspective, work with them in terms of their quality of life, impacting their day-to-day, understanding not just them, but their families and their caregivers as well. So it was a nice combination for clinical neuropsychology to be able to work with patients, understand their medical histories, but then take it a step further and kind of incorporate that into interventions and quality of life. My approach to patient care, especially as a neuropsychologist, is a focus on quality of life and what we call brain health. And so I'm always thinking about what are the implications for somebody in their day-to-day life. So when they're coming into my office, I'm asked them to do a memory task where I read them a list of words and ask them to repeat it back to me. And people are wondering, well, if I can't do good at that, what does that mean in terms of my daily life? Well, that might mean, is it going to be harder for you to go grocery shopping? Is it going to be harder for you to remember to take your medications? So I always like bringing it back to their daily life and focusing on the things that we can change. So what are some brain health, lifestyle, modifiable factors that will have a real impact on your life? And so talking to patients about how to incorporate that into daily life. I think the most rewarding thing about neuropsychology is the opportunity to make lifestyle behavior changes for somebody and have a real impact on their quality of life. So when they're coming into the office, they're not just getting a diagnosis, they're understanding a little bit more about why their behavior is so important for their brain and for their ability to age healthily and to think about, why is it that it's important for them to be able to continue to do these things? Is it spending time with family, going on vacations, enjoying their retirement, and how can we make their behavior change match up with their ability to do those things? So I want them to come into the office, understand the influence of their behaviors on their health, and then help them understand ways to implement those changes in a way that makes sense for their life. So it's really individualized.